My name is Tristan Watson, and I'm going to be talking about the effects of the sliding technique on hamstring flexibility. So, this is going to be a neurodynamic technique and how we can increase hamstring flexibility. And just an introduction here. It talks about hamstring strains. This is going to be an injury that is very common because of poor flexibility, insufficient warm-ups, muscle imbalances, and also neural tension. So it is going to be the limited range of motion or flexibility of the hamstring that is due to the lack of hamstring extensibility. So that's going to lead to the strains and injuries that we commonly see during sport. So it's actually that we cannot extend the hamstring, and that's going to be that lack of range of motion that increases the likelihood of an injury. So when we're looking at neurodynamics, this is going to be the movement of the nervous system. So that's how it explains it in this paper, and it's going to be the integration of the morphology and the biomechanics of the physiological breakdown of the nervous system. So it's going to be the lengthening of the muscle based on the alteration of the pain sensation when stretching. So it's just going to be kind of messing with our pain sensation and kind of retraining our neurodynamics of how we interpret pain while we stretch. So it's going to be it's going to incorporate that sensory theory. So it's going to be developed for a new stop point. So there's going to be a new point of which during that stretch, we feel that pain. So that's going to be the sensory theory. It's going to be a new point in which we feel that pain during the stretch. So the purpose is to determine the effect of the specific neurodynamic intervention of the single leg raise to assess hamstring flexibility and range of motion. So what the researchers wanted to hypothesize was that neurodynamic sliders would elicit a greater ipsilateral increase of the single leg range for the controlled treatment. So they thought through the neurodynamic sliders, this would increase the single leg raise and also range of motion of the hamstring for that group. So the methods of this study, the participants was a convenient sample of 28 males. All ages were from 19 to 22 years old, so a relatively young group here. They had to have had no hamstring injuries, no neurological diseases, femoral fractures, or low back pain. So the measurement of hamstring flexibility is a passive single leg raise to determine hamstring extensibility. So they're using a goniometer to assess the range of motion in degrees, and they did a pre and post test for this group here. So there were two groups. One group got the neurodynamic sliding intervention. This incorporated 3 sessions of the neurodynamic sliders, which you could see on the right there. So that's going to be the bottom picture there. That's going to be an example of the neurodynamic sliders. So you're pointing the toes down, and then you're also flexing the knee and pointing the chin down, and then you are extending all your joints and then pulling the neck back. And that's going to be an example of the neurodynamic slider stretch there. So for the group, the control group, there was no intervention. So all they did was have a pre and post test for the single leg raise to assess their hamstring flexibility. So for this intervention, they just had the sliding technique versus a control group that got no intervention there. So the pre and post test was just a single leg raise to interpret the hamstring flexibility and extensibility. So what we saw was the control group. They only had a 0.2 degree improvement in range of motion compared to the intervention group that got the sliding technique, which is a 9.4 degree improvement in range of motion. So that's a very huge and significant improvement for the sliding technique group. So we saw a significant interaction between the intervention group and the hamstring extensibility. So we saw an overall increase of range of motion using the sliding technique for that neurodynamic technique there. So discussion here. So increasing our hamstring flexibility could and prevent lower extremity overuse injuries. Increasing that flexibility and increase the point of pain threshold could be improved through neurodynamic stretching techniques to increase range of motion. So if we find a new point of pain that it said earlier, if we increase that range of motion and find that new pain point, that's how we can improve our flexibility and extensibility through this neurodynamic training. So we could change the perception of the stretch or pain associated with flexibility testing. So neurodynamic sliding technique could be used to increase flexibility and range of motion by modifying the sensation of the stretch to pain ratio there and increase extensibility and flexibility. Future research should be used to find other interventions and compare it to other interventions that are used, whether it be other interventions to increase flexibility. But here's the reference here. So hopefully y'all enjoyed this and learned a little bit more about neurodynamic techniques.